Despite what its name says, heartburn has nothing to do with your heart. It's a burning sensation in your esophagus, which is a 10-inch tube that links your mouth to your stomach. Heartburn can last just for a few minutes or as long as many hours. It's uncomfortable in any case, so it's no surprise if you're looking for a way to get rid of the sensation fast. To treat any problem, we must first identify its underlying causes. So, what exactly causes heartburn, and what does it feel like exactly? Heartburn is caused by gastric secretions refluxing from the stomach into the esophagus. The stomach's acidic contents are required to break down the food you ingest, which your stomach can easily handle. On the other hand, your esophagus is irritated and can even be injured by it. The lower esophageal sphincter, a circular ring of muscle at the tube's base, functions as a valve to keep the acidic contents of your stomach out of your esophagus. When this valve is relaxed, food from your stomach is allowed to pass through. When this valve is closed, food and acid are stopped from backing up into your esophagus. Acid reflux happens when this valve relaxes abnormally and allows stomach contents to go back into your esophagus. The most well-known and evident symptom is heartburn. We now understand what causes heartburn. Let's look at some other factors that contribute to gastric secretions backing up into the esophagus. Acid reflux can be exacerbated by specific foods, beverages, and lifestyle choices. Managing stress and anxiety. This reason may surprise you, but stress and anxiety have been linked to a variety of physical health issues, and one of these connections is the association between stress, anxiety, and gastroesophageal reflux disease, commonly known as acid reflux. Stress and anxiety can stimulate the production of stomach acid and trigger the release of stress hormones like cortisol, which can impact the normal functioning of the digestive system. These hormones can cause muscles in the digestive tract to contract, leading to changes in the way food moves through the system. When digestion is disrupted, it can contribute to the backflow of stomach acid into the esophagus. Managing stress and anxiety through techniques like mindfulness, relaxation exercises, therapy, and lifestyle changes can be helpful in reducing the impact of stress on GERD symptoms. Don't drink too much coffee. Drinking coffee is a daily ritual for many people, providing a jolt of energy and mental alertness. However, excessive coffee consumption, especially in the form of strong or acidic coffee, has been linked to various health issues, including acid reflux. The combination of acid content, caffeine's effects on esophagus relaxation, increased stomach acid production, and potential irritation of the esophagus all contribute to the likelihood of experiencing acid reflux symptoms. Adjust your sleep position. Elevating your head and chest higher than your feet as you sleep will help prevent and reduce acid reflux and heartburn. You can do this by placing blocks beneath the bedposts or a foam wedge under the mattress to raise the head of your bed. Beware of layering pillows, as this normally isn't useful and may even make your problems worse. It's also claimed that sleeping on your left side might assist digestion and may work to prevent stomach acid reflux. Limit your intake of carbonated beverages. Carbonated beverages, which are often referred to as fizzy drinks, are known to be associated with gastroesophageal reflux disease. Regular consumption of carbonated beverages, including soft drinks, club soda, and seltzer, could increase the chances of acid reflux. This could be because the carbon dioxide in these drinks causes you to burp more, which increases the acid pouring out of your esophagus. Manage overweight. If you have excess belly fat, it increases the risk of heartburn or acid reflux by putting extra pressure on the stomach and weakening the lower esophageal sphincter, the muscle that prevents stomach acid from flowing back into the esophagus. This can lead to gastric acid entering the esophagus, causing discomfort and heartburn. This condition, known as hiatal hernia, is considered the leading cause of GERD. Obesity in general, is linked to an increased risk of GERD due to increased pressure within the abdominal cavity. Limit alcohol intake. Excessive alcohol consumption has been linked to increased acid reflux symptoms. Because alcohol boosts stomach acid, relaxes the lower esophageal sphincter, and hinders the esophagus's ability to clear out acid. Additionally, alcohol stimulates stomach acid secretion, intensifying the risk of acid reflux. Moderating alcohol consumption can help mitigate these effects and reduce the likelihood of experiencing GERD symptoms. Avoid high-fat foods. High-fat foods trigger heartburn due to their delayed digestion, leading to prolonged stomach pressure. Fried foods, pizza, bacon, sausages, and some other fatty foods are major contributors to GERD. These foods also stimulate the production of stomach acid and causes bile salts to be released into your digestive tract, which irritates your esophagus and exacerbating the issue. Moreover, they stimulate the release of cholecystokinin, a hormone in your bloodstream that aids in relaxing the lower esophageal sphincter, allowing stomach contents back into the esophagus. Quit smoking. Saliva helps to neutralize the acid that rises from your stomach and enters your esophagus. However, smoking might decrease the amount of saliva in your mouth. Smoking also reduces pressure in the lower esophageal sphincter, which can lead to coughing and acid reflux. You can reduce the severity of acid reflux or GERD by quitting smoking. Eat dinner earlier. If you have acid reflux, the International Foundation for Gastrointestinal Disorders recommends eating dinner a few hours before going to bed. Consider also having a smaller meal at dinner, while a big meal will stay longer in your stomach, putting extra burden. According to research, going to bed with undigested food, especially if you've had a large meal, may exacerbate your symptoms at night. Opting for cooked onions instead of raw. Raw onions are a typical cause of gastrointestinal issues, such as acid reflux and heartburn. The reason is raw onions are more difficult to digest and may irritate the esophageal lining, resulting in increased heartburn. If you enjoy eating onions, consider cooking them. Eat smaller, more frequent meals than 3 big meals a day. The lower esophageal sphincter is a muscular valve that connects the stomach to the esophagus. This muscle is weakened or malfunctioning in acid reflux patients, allowing acid to flow up into the esophagus. Unsurprisingly, many reflux symptoms occur after eating. As a result, eating smaller, more frequent meals throughout the day can assist with reducing acid reflux symptoms. Follow a low-carb diet. According to research, eating a high-carb diet may worsen acid reflux, while lowering your carb consumption can help reduce GERD symptoms. This is because undigested carbs lead to bacterial overgrowth and increased pressure inside the abdomen cavity, which could contribute to acid reflux. If too many undigested carbs are left in the digestive tract, it can cause not only gas and bloating, but also burping. Avoid mint if needed. Peppermint and spearmint are common herbal tea ingredients and are used to flavor foods like candy, chewing gum, mouthwash, and toothpaste. However, studies show that peppermint oil may lower esophageal sphincter pressure, which can cause heartburn. Another study discovered that menthol, a component found in mint, could aggravate GERD symptoms. For this reason, it's best to avoid mint if you feel that it makes your heartburn worse. Foods that can help treat heartburn. The good news is that there are plenty of things you can eat to help prevent acid reflux. Consider consuming alkaline foods like melons, cauliflower, fennel, and nuts to help counter strong stomach acid. Milk can also offer relief by acting as a buffer. Non-fat milk is preferable due to its soothing qualities. Water-rich foods like celery, cucumber, lettuce, and watermelon dilute stomach acid. Ginger, with its anti-inflammatory and alkaline properties, aids digestion and can be consumed as ginger tea. Many people can alleviate their symptoms by making changes to their lifestyle. Others might need medication to prevent or treat acid reflux and heartburn. If heartburn persists beyond a few days, contact your doctor for suitable medication. Heartburn is an uncomfortable ailment that can be caused by a variety of different factors. If you discover that your symptoms are worse after you consume particular foods or beverages, it's sensible to limit or avoid these things. Try some of the tips above to find what works for you and let us know in the comments below. Thanks for watching, and we see you next time.